Next to the global concern over the spread of a deadly new strain of mpox from parts of Africa, China has announced heightened screenings for goods and people coming from areas where the new, highly contagious strain of the disease has been detected. The World Health Organization, which declared a global public health emergency on Wednesday, says more cases of the dangerous variant are likely to be found in Europe in the coming days after Sweden reported the continent's first infection and has urged wealthy nations to share treatments and vaccines. Simon Jones reports in the Democratic Republic of Congo, the country hardest hit, public health campaigns are underway to warn people of the dangers of mpox, originally known as monkeypox. It's transmitted through close contact such as sex, skin-to-skin contact, or breathing close to another person. It causes flu-like symptoms and skin lesions. They often clear up within a couple of weeks. But mpox can be fatal, particularly for people with weakened immune systems. 3 of my children and I were infected. 1 was treated here and the other 2 were taken to hospital. After 2 weeks they were discharged. A week later my wife was infected. Now a case of the more dangerous strain of mpox has been recorded in Sweden. The authorities say the person became infected during a stay in an area of Africa where there is currently a major outbreak. It is very probable that we will see more cases in Europe in the near close time, so it's important for all countries to be aware that this can happen. There have been 450 deaths in the Democratic Republic of Congo following an outbreak of the new strain. It's also been detected in neighboring countries, including the Central African Republic, Uganda, Kenya, Rwanda, and Burundi. Dr. Mira Chan from the UK Health Security Agency said the risk to the UK population is currently considered low. However, planning is underway to prepare for any cases that we might see in the UK. This includes ensuring that clinicians are aware and able to recognize cases promptly. Outbreaks can be controlled by preventing infections with vaccines. The UK government says it has stockpiles as part of its preparedness plans. The World Health Organization says a coordinated intern response is now vital. Simon Jones, BBC News. We're joining me now are our health correspondent Dominic Hughes in Nigeria, our Africa correspondent Simi Joel Oso, and our correspondent Iman Folks, who is in Switzerland where the World Health Organization is headquarters. Let me speak to you, Simi, first about how the countries in Africa are dealing with this and these huge concerns about the number of vaccines which are acquired. I read there are huge concerns. So 2 countries have been given approval for sorry there are huge concerns. Sorry about that. 2 countries have been given approval for emergency use of the vaccines. Nigeria and the Democratic Republic of Congo. So Nigeria has said that they have been able to get access to 10,000 vaccines. When that will be, we're not so sure yet. My apologies. There's a really bad sound coming from my earpiece and it's a bit deafening, but I will continue. Apologies for that. Yes, so 2 countries, the Democratic Republic of Congo and Nigeria said they are expecting 10,000 doses imminently. As we heard in that report, they're sorry. I'm so sorry. I might have to cut this. We'll just leave it there with. We'll try and sort out the technicals with her. Let me just bring you in Imog in folks, because there's this call, isn't there, for more wealthy nations to actually donate vaccines. Do it talk is through what's being said on that front. Well, we heard from both the World Health Organization and the Red Cross this morning. Now the Red Cross has its local teams on the ground in DRC, and they talked about a really serious complete shortage of treatments, vaccine, inability to trace and test as well, and of course these are the key elements to control a disease outbreak. Now we know I'm talking to you now because we found a case in Sweden, right? I mean, the epidemic in DRC has been going on for over a year, and that is where the vast majority of cases are concentrated, with some spread to neighboring countries in Africa. So the WHO would like wealthy countries which have stock by mpox vaccines after the last outbreak 2 years ago to donate them to the most vulnerable, and those are people in the affected countries, particularly DRC, and as quite bluntly 1W Officials said this morning control it. Where it's raging and it won't come to. You yes okay well let's bring in Dominic Hughes. We were just hearing in my introduction about how China is starting to screen goods as well as people in terms of how this strain can be spread. Can it be spread through goods? Not that I'm aware of. My understanding is that it can be spread through close physical contact. Not just sexual contact but just shaking hands with someone or hugging someone or cuddling someone, but also as I understand it through bedding. Blanket sharing, bedding and blankets. That can also if you share bedding with someone who has these postures, these lesions that can, because they are absolutely loaded with virus that can also be a source of contagion. I'm not aware of inanimate objects doing that as well. The Chinese might know something I don't, but it is clearly this variant that is driving this surge of cases in particularly the Democratic Republic of Congo, but now other countries in Central Africa as well. Well, this is clearly more infectious and more deadly as we understand it. There's still, I think, quite a lot that's not known about this variant. It's known as a CLA, it's known as CA1B, but it's clearly more deadly and more infectious than the variant that drove the big global outbreak in 2022-2023 that affected more than 100 countries and saw nearly 100,000 cases worldwide. And of course, people memories will turn to the early days of the COVID virus and the restrictions that were brought in for people in terms of travel and that sort of thing. Do you think the lessons have been learned from COVID and that they'll be using that experience in this instance? Yeah, I think there are definitely some lessons that have been learned. The value of contact tracing, for example, of having really good public health surveillance, of trying to sort of use both vaccinations and public health information to help those groups who are most vulnerable to this to know what measures they can take to keep themselves safe. I think those are all very valuable lessons. But we've heard from the World Health Organization this week already that they don't believe, for example, closing borders really works, and we know also that, for example, things like lockdowns and closing schools, they have tremendously damaging effects outside of the populations you're trying to protect. So there are lots and lots of lessons I think that still could be learned from the COVID outbreak. Yeah, well, let's go back to Imagine then. Imagine, has anything been said on that front from the WHO in terms of what restrictions countries should be looking at perhaps? And like Dominic was saying, not talking about closing borders. Yet it was said very clearly by both the World Health Organization and the Red Cross this morning that travel restrictions do not work. In fact, they can actually compound the situation, because people will still move around. But you've completely lost your ability to trace and test, because if you told them they can't move and they still move, they don't want you to know anything about them at all. So it's actually counterproductive. So we are expecting some recommendations from the WHO at some point this afternoon about what countries should be doing, but I can tell you with pretty on 100% certainty that border restrictions and closing borders will not be among them. It will be the same things we heard over and over again with COVID test, trace, be transparent. The WHO is very praising of Sweden for coming straight out and saying we have one case, it was imported. This person is now in isolation, and that this is crucial to combating a disease. And again I come back to generosity, sharing of treatments and vaccines to the most vulnerable first at the moment. They appear to be children in DC.